Grenada's healthcare sector offers a range of services that cater to the needs of all communities and promotes better quality of life. The Ministry of Health, located at the Ministerial Complex in the Botanical Gardens, St. George, is the home to several departments that oversee various aspects of healthcare, including community health services. The administering of healthcare is well organized into different zones or districts. Within each district can be found a health center. Smaller medical stations are strategically placed within a few miles of each other. Each medical station is assigned to serve particular communities.
We have 36 community health facilities, 6 health centers, and 30 medical stations. The difference between a health center and a medical station is that there are more services offered at the health center than at the medical station.
The medical stations are often well attended because of being stationed within the hearts of the communities, making it easy for clients to access. Several services are offered at the medical stations. These include and are not limited to dressings, blood pressure and blood sugar tests, breast examinations, pap smear screening for women, and voluntary counseling and testing for HIV. At the larger health centers, additional services such as eye examinations are offered. The District Medical Officers Clinic, or the DMO Clinic, gives clients the opportunity to see a doctor in their very own community and access this service for free. Nurses also use the DMO Clinic to ensure proper monitoring of patients continuing care. The DMO Clinic is held twice per week in health centers and once per week at the medical stations.
The District Medical Officers Clinic is supposed to start from 8:30 to 9, and he would be here for at least 4 hours. What we really offer on that day is the access to our medical doctor. We also do blood pressure checks, we do blood sugar checks, we will do weight, nutritional education, we do counseling sessions at the clinic, and as the people sit in the waiting room and wait, we do lecture discussion on different topics. So we would give information and the clients would have the opportunity to in turn interact with us and ask us questions before they go in to see the doctor. The doctor's clinic here is a free clinic.
Chronic disease has emerged as one of the most common conditions affecting the Grenadian population. At the Chronic Disease Clinic, people who live with diabetes and high blood pressure receive special care.
In the medical station, we have Chronic Disease Clinic 1 day per week. At the health centers, they also have their Chronic Disease Clinic where it is run by the nurses and so, and we have a day that the district medical officer sees chronic disease clients only, right? So clients that we at the medical station cannot manage, they realize they're really uncontrolled, we would refer them on to the district medical officer at his chronic disease clinic at the health center on that particular day. In our chronic disease clinic, what we do is kind of similar to, the routine is similar to the district medical officer, because the client comes in, you'll get the blood pressure checks, the blood sugar checks, foot examination, foot care is done, their weight, their height, to do their BMI, and after that we plan sessions. On different clinic days we would have different sessions. We would do a discussion on exercises, we would do some simple exercises with the client, show them, some people may have arthritis like the elderly, and we show them that you don't have to go jogging or you don't have to go walking busy down the road. You can use your chair at home to exercise. You can use sweeping to do exercise. So we try to do simple things with them to enable them and encourage them to exercise, right? We also would do lectures on different stages of the disease, like we let them know what is diabetes, what are the signs of diabetes. We educate them on the medication that they should take, because in Grenada we realize that a lot of persons are taking medication and they don't know the names. So we educate them on the names of the medication, why it's important for them to take the medication, why they should stick to the routine. We do sessions on end-stage diabetes, like your kidney failure, renal complications and things like that. We do all different sessions with them. One of the importance of this clinic is really to emphasize that chronic disease is a lifestyle disease, and is a disease that we can prevent. We can avoid chronic disease if we choose to change our lives, change our lifestyle, the way we eat, the way we function on a day-to-day basis.
Chronic disease clients are encouraged to monitor and manage their condition closely.
Clients come to the health center when you're supposed to come, when you have your appointment. If you feel sick in between that time, you come. If you don't feel well, if you feel uncomfortable, if something goes wrong, it is better to come rather than stay home and let the worst happen.
Expectant mothers can access the antenatal clinic during weekdays, where they receive specialized care. This is a very important clinic, and pregnant women are strongly advised to book early and attend consistently throughout their pregnancy.
Antenatal care is needed from the time you missed your first period right up to delivery. For the normal pregnancy, we see you every 4 weeks up to the 28th week of pregnancy. Then every 2 weeks up to the 36th week, and every week until delivery. For the first visit, we need to check the mother's weight, blood pressure, urine, take her into the midwife, get a complete physical examination of her. We need to do specific blood investigations. It's really important that mothers come to the antenatal clinic. And I must say also that we encourage that mothers visit the clinic at the first sign of the missed period. So you miss your period, you should not wait and then say, okay, I'm going to wait until I'm 4 or 5 months. As you miss your period, you should seek antenatal care. And we advocate within the first 12 weeks of the pregnancy. So the first trimester, you should see a medical practitioner, whether it's a midwife or obstetrician.
Expectant mothers should be prepared to deliver their babies at the hospital, as most health centers and medical stations are not equipped to perform deliveries. However, the Sauters Health Center maintains an attached maternity unit, and its operations are usually 24/7. After childbirth, it is critical that the mother and her newborn baby are monitored closely and that all necessary vaccines are given. Postpartum mothers are seen 6 weeks after delivery.
Once a patient has delivered and they're back at home, we ask them to call us, right, to inform us that they're home. So they are entitled to 3 home visits within 10 days of delivery, right? Now, they don't always get it because sometimes, because of some reason, they have to stay at the hospital a little longer. But whenever we get the information, we try to at least give them 1 or 2 home visits. I just want to encourage the mothers who have had the babies already, the postnatal mothers, to really access that 6 weeks clinic at your medical facility. It's very important that you get your 6 weeks check, ensuring that your body has come back to its normal state, and it's very important as women that you have your pap smear done, right? We also offer at the postnatal clinic at 6 weeks the MMR vaccine. That's for the mother, so that's part of it also, and that's where we start the baby's vaccine and to examine the baby.
Attending the child health clinic is essential for monitoring a child's development. Children are weighed, examined thoroughly, and vaccinated against early childhood diseases.
We ask parents to come in when you get the appointment, because the child health clinic is not just about giving vaccine. You need to check the child, like I said, to see if the growth and the development is okay, to do referral, whether it's to the pediatrician, the dermatologist, the nutrition officer, you have to follow up the child. So I would really like to encourage parents to visit the clinic. We have the appointments at the back of the card. Look at your appointment date and visit the clinic when you have your appointment. And any problem, we always tell them, even if your child is scheduled for 2 months, if the child have a problem before, you come back to the clinic, and a number of them come. But we have the few, that sometimes they so taken up in other things that they can't find the time. If you cannot come, the fathers could come. We encourage, that's one of the things that we encourage, and more and more we've seen a lot of fathers coming forward with their children, or even with their partners at the antenatal clinic.
In Grenada, most of our childhood diseases are eradicated, and that's because of the excellent vaccination program we have. So that is why we encourage mothers to bring their children to get vaccination. And Grenada has an excellent program. We have the main vaccine-preventable diseases. We have those vaccines, for example, hepatitis B, polio. We don't hear of those things anymore, and that's because of the program that we have.
Weekly mental health clinics are scheduled in community health centers. This aspect of healthcare is very important. It helps identify, counsel, and offer treatment options to mentally ill clients. The primary source of treatment is given at the Mount Gay Psychiatric Hospital.
We have social workers. We have community mental health workers who can meet with these patients, maybe at their home in the clinics, and speak to them, because not everybody who might need to be either admitted or even treated. Sometimes by just talking, find out what the problem is, you can talk to the patient, and depending on if medication is needed, we do have medication. Depending on what the cause, whatever they are showing, the signs and the symptoms, we do have medication that could be given to them, and so they are treated. We also have here at the hospital, though it's not at the level at this point in time that we would like it to be, occupational therapy, which go hand in hand with the treatment of the psychiatric patient. It's a very important area in the treatment.
With all these accessible clinics located throughout Grenada, all are urged to make use of the facilities to ensure that good health is maintained.
We are just trying to advise clients that the facilities are here. So to utilize the facility, right? Because some persons might be at home and they're saying they have no money to have a pap smear done. Pap smear is done here every Wednesday, every other day in a different clinic. But some people would sit there and they say they don't have money to go and access those things, and these things are free. Dental care again. We realize that we have a lot of kids running around with dental problems. And here in every district in the health center, there is a dentist that deals only with school children.
If you have any questions related to times and days of clinics scheduled in your area, be sure to ask your public health nurse.